On Monday, some bombshell news of coronavirus came out. Maria Van Kerkhove, the technical lead at WHO, stated that the coronavirus spread by asymptomatic people appears to be rare. This is exactly what she said. From the data we have, it seems still to be rare that an asymptomatic person actually transmits onward to a secondary individual. She wanted to focus on symptomatic people for coronavirus treatment and testing only. And the implications are huge. As one doctor here states, we can reopen. Basically, all this panic and hysteria was about nothing. Of course, he's a urologist, his business has been hurt by the pandemic, and he knows nothing about infectious disease. But now the WHO has clarified her statement, basically retracted it and said, we don't know. Huh? What's really going on here? Can we use logic to make sense of this mess? First off, let's look at Maria Van Kerkhove. The WHO has a bio page on its leaders, but it doesn't give us much about her background. Let's go look somewhere else. Wikipedia tells us she's American-born, has a PhD in infectious disease epidemiology from the London School of Tropical Medicine, which is a renowned institute for tropical medicine. She's a PhD epidemiologist, not a medical doctor. Her expertise should be in tracking outbreaks and policy, not actually treating patients. She should know an awful lot about transmission of disease. If we look at what she said on Twitter, luckily she didn't delete it, she describes herself as an infectious disease epidemiologist, a mother of two, and puts a disclaimer that all opinions are my own. Similar to how a lawyer will always tell you to seek legal counsel, this is just his opinion. Basically, most people believe she represents the WHO. However, her disclaimer is just similar to a terms and condition click sign for your app that you basically ignore. What does she say exactly? She says they published something about asymptomatic spread of coronavirus, and I see page 2. And then she emphasizes that asymptomatically infected individuals are much less likely to transmit the virus than those that develop symptoms. And in her briefing on Monday, she said it is very rare that asymptomatic individuals actually transmit the virus. As you can see now, she's basically retracted what she said. She said it was a misunderstanding. WHO said it was a clarification because nowadays nobody ever admits that they're wrong. But if you say very rare and it's not very rare, then basically aren't you wrong? Was she wrong? Let's look into this further. Rarity. Is there a definition of what rare is? You may say Parkinson's is rare, and I agree it's rare. Most people don't have Parkinson's disease, but if you work as a neurologist, it's not rare at all. You see it an awful lot. You also may see asymptomatic coronavirus infection as very rare based on data coming out of Wuhan, but it's not rare here in the US or in most other countries in the world where they haven't been locked down for months and they've done massive testing campaigns. Rare is actually not a technical term, has no agreed upon definition. For beef, however, rare is better defined. So did she mean very rare as in rarer than rare, maybe blue side of things? If we delve further into her comments, she mentions the recent WHO mask guidelines. Let's take a look at this. It'll help us clarify the meaning of symptomatic, pre-symptomatic, and asymptomatic transmission. Symptomatic is easy. You have symptoms, cough, fever, you're ill. The concept is that most transmission occurs from symptomatic people. That's quite easy to accept. It makes medical sense. It's logical. Very few people doubt this. Then there's what we call pre-symptomatic, the idea that you got it but aren't yet symptomatic. We do know people can test positive days before they have symptoms, so they could be shedding already. And this concept has been proven in other aspects of the field of medicine. I made a graph of the temperature compared to the amount of bacteria in the bloodstream. When the temperature is above a certain point, it's called a fever. This is the line that is rainbow colored. We usually draw blood cultures in a hospital at this point. However, many times it takes a while for the lab personnel to get the blood culture and there ends up being no actual growth of bacteria. I asked one of my attendings in residency why, and he noted that the amount of bacteria in the bloodstream actually is highest right before the fever. The bacteria are already there in your body, in your bloodstream. They've multiplied. They're having a party in your blood. But your body doesn't react until a little bit later. It takes some time for the cytokines, all your body's signaling hormones, to get the body ramped up, activated so that it mounts a fever. And so it makes sense that people can have the infection, their body hasn't reacted yet, but the virus has already multiplied and is shedding before they actually have any symptoms. Asymptomatic is defined as people who don't ever develop symptoms. Ever? As in a few days, a month? How long? And we have plenty of evidence in the medical field as well that asymptomatic does not mean okay. This is somebody with a diabetic foot ulcer we commonly see in a clinic, in a hospital. Most assuredly, this man is asymptomatic, as in he doesn't have pain from this. And that's exactly why he gets it, because diabetes has killed the nerves in his feet. He cannot feel the bottom of his feet. It rubs, it gets eroded, he gets an ulcer. Asymptomatic does not mean he is fine though, and that's an important point to emphasize. And the WHO document confirms this. In China, they had asymptomatically infected individuals who infected other people. One study found 14%. We know they could be shedding the virus. There's another study that showed no transmission, however. But I'm sure if you wanted to find people that were symptomatic, infected with the coronavirus, that didn't infect other people or any of their contacts, you could find those people. Just because you're infected doesn't mean you have to infect other people you come in contact with. Obviously, that's why we wear masks, to decrease the spread. If someone's infected, it's recommended they wear the mask to reduce transmission to others. Everybody agrees on that point. It's hard to understand public officials sometimes when they seem to be constantly changing their positions. Some of it may be due to new evidence, and some may well be politics. If you look here at Singapore's U-turn on a policy to not wear masks, the Prime Minister says new evidence. I think the real reason behind this is he wanted to save the masks for the healthcare workers. Though I'd hope by now that they would be using N95 masks instead of regular surgical masks in the hospital. The WHO said Maria misspoke. She said she was speaking personally, not as a representative of the WHO, not as their policymaker. But, I would say when you're on TV, they're interviewing you because of your role in the WHO, you're pretty much speaking in official position. Is what she said actually consistent with the WHO policy? She actually retweeted the WHO position. Every case should be found and isolated. There's no qualifications on this. So it seems like she's actually misrepresenting their position. We talked last time about Wuhan testing its entire population. This was mass testing not based on symptoms. They found 300 asymptomatic cases. And even though they said they weren't worried about transmission from these asymptomatic cases, they still isolated them, these 300 people who tested positive. Why? To be extra sure? Even if it's very rare? As you know, the WHO has retracted Maria's statement, saying it was misunderstood. I would just say Maria is wrong in making a statement that is very rare. At least one study showed it wasn't rare. It definitely does happen. In terms of how frequently it happens, it depends on many different factors, not the least of which is where you are. Let's go back to the beef example. We all know different rarenesses of beef have different risks, because the longer you cook it, the more bacteria you kill. There is that warning that comes on every menu that not fully cooked meats or undercooked meats are a risk for transmission of disease. But let's use this picture of steak, and instead of thinking about the risk of getting sick from eating rare beef, let's think about the risk of somebody transmitting the coronavirus. Somebody who's symptomatic is at higher risk for transmitting the disease. Somebody who is pre-symptomatic is at lower risk than somebody who is symptomatic, but higher risk than somebody who is asymptomatic. And somebody who is asymptomatic is at lowest risk for transmission of disease. And so at Peter Luger's, a steakhouse in New York, you would have a moderate risk of getting sick from eating the beef because it's not fully cooked. Whereas at McDonald's, you don't have to worry. It's well done. To show how it differed by country, let's look at this graph. I didn't label it because we actually don't know the data, but imagine if blue is symptomatic transmission, yellow pre-symptomatic, and red asymptomatic. Different countries would be different because if you have a country that has more symptomatic transmission, the other types of transmission would be correspondingly decreased. And in different policies, it'd be logical to think that China actually has less symptomatic transmission. Because as soon as you're symptomatic, they know. They'll take you in, test you, isolate you. Temperature screening everywhere is just one method they use. Whereas in the US, the government doesn't actually track anybody's symptoms. One patient flew even when she had the coronavirus. And when I flew back to California from Singapore, I saw no screening at the airport. There was no quarantine period that was requested of me either. So it makes sense that in the US, more people will be infected via symptomatic cases. And thus corresponding, there is less asymptomatic carrier transmission. And just in case there's any doubt that asymptomatic people can transmit disease, let us not forget about Typhoid Mary. She had absolutely no symptoms, yet she was shedding Salmonella typhi bacteria like crazy. And because she worked as a cook, she is able to infect many people. In conclusion, it's impossible to make a blanket statement like Maria Van Kerkhove made, that transmission of coronavirus by asymptomatic persons is rare. It depends on a variety of factors. One is location. In places there are more asymptomatic people spreading it, then correspondingly there would be less spread by asymptomatic people. In general, people who are symptomatic should be able to spread it better though. Occupation. Whether one can transmit it and how many one can transmit the coronavirus to depends on one's occupation. Typhoid Mary was a cook. She gave it to the people who ate her food. A worker at a nursing home can more easily spread it given they deal with people who have weaker immune systems and are more likely to get it, less likely to fight it off. And lastly, behavior. With measures like masking and hand hygiene, the curve was flattened. In a hospital, there are many infectious people, but it's unlikely for you to get infection from them because they take many precautionary measures. Rare? Very rare? What did the WHO mean when they say Maria was misunderstood? Maybe she meant rare as in when people say diamonds are rare. They are rare in that people whose only knowledge of diamonds comes from De Beers ads think they're rare, because diamonds actually aren't objectively rare. There are quadrillion tons of diamonds inside the earth. They're actually the most common of the precious stones. Rubies, sapphires, emeralds are all much more rare. And so the concept of rare transmission for asymptomatic cases of coronavirus, yes, they're rare just in the same way diamonds are rare. Rare in some people's minds, but not in reality.